Hi, this is Dr. Nick. I'm here at CES 2020 at the Digital Health Summit. I'm delighted to be welcoming Lisa Ernhardt. She is the Executive Vice President for Medical Devices at Abbott. Lisa, thanks for joining me.
Thrilled to be here.
So, Abbott's doing lots of interesting things. I had some personal experience we were talking about a little bit earlier with some of the medical devices. Tell us a little bit about some of the innovation that you're seeing on the show floor that you're excited about.
Yeah, I think, it's so exciting all the time to be at CES, right? And we're oftentimes talking about smart devices. So It's your smartphone, it's your smart refrigerator, your smart car. And what I love is all to be thinking about, and what I see here is really the potential for the smart body. Right, so as I think about where technology...
I keep wishing mine was a smart body, I'm just going to say.
I know, but you think about where technology is today and where it's heading with the advent of sensors and AI and miniaturization. We are on the brink of really bringing patients to the center, consumers to the center of healthcare, and engaging them in ways and putting them in control of their health that we've never had before. So there is a real possibility for you today to be sitting here. Imagine this, sitting here, watching your mother's heart rhythm, knowing what you should change in your, for lunch because of your glucose levels, or alleviating your pain, just with the touch of a smartphone.
Well,
so that's possible today.
I agree, and I'm smirking a little bit because I did that with my own mother some 5 years ago, but over FaceTime and trying to explain how she could grip the little device that I had sent her for that EKG. Now it's simple, it's all built in, and we've got this opportunity to really understand what are we going to do with all of this data? How are we helping people process that?
Yeah, and I think the important thing is how do we think of it and translate our thinking from data to information, and then to ultimately insights that are actionable.
Right.
And really meeting the patient where they are, whether it be time of day, whether it be geographic location, and whether it be the amount of data that they're getting, right? And ideally, it's not all of the data, it's just the data that really matters at that time, right? So maybe in the case of a glucose sensor, all we're doing is telling a person with diabetes that their blood sugar is too high and they need to do something about that, right? So we're just alerting them if there's an exception or something that needs to be taken care of. So you can predict and prevent a condition from getting worse.
And I think what's really interesting about this is it's tipping the balance more towards the patients to put them more into control of their individual conditions, their interaction with the world. And it's all different, right? I mean, that's what we're learning about this.
Yep, absolutely. And the fact that, they're getting that information, and then maybe instead of I think about a heart rhythm, if you had a patient, and an individual that maybe had heart problems, and you had to get an EKG, years ago, you would have, not even years ago, even today, some individuals will go into the physician clinic and actually have to get a 30-second strip. So that's not a great use of time or resources for either a person or an individual or the clinician and the healthcare dollar, right? And now that can just be done with a little paper clip size implant that gets you that information 24/7.
And pre-sent so that people can actually monitor, look at it ahead of time, and then only engage or interact when there's problems and require.
So I think that exception-based medicine is key to how we can really bend the curve in terms of healthcare expenditures.
Both cost and also
outcomes. It's the holy grail,
absolutely.
Right? If we improve outcomes and lower costs, and we absolutely have the opportunity to do that with new technologies.
There you have it, the holy grail of medicine. Lisa, thanks for joining me today.
Yeah, thank you so much.
This is Dr. Nick. I'm here at the Digital Health Summit at CES 2020.